traveling.
Committee. They have a committee.
Okay.
Yeah.
Well, I will let you do the welcome and then,
Yeah. But if we see him, we'll definitely
yeah,
pause for a
of
minute.
course.
Up there he is. Good morning, everyone. We'll let everybody get in on this absolutely beautiful Tuesday morning. Very, very different than the Tuesday we experienced last week. I like this 9 o'clock time. Everybody looks happy. Everybody is ready to go. Must have had plenty of coffee this morning. Appreciate everybody joining. Okay, well, I just want to welcome everybody for participating in today's systems improvement team. Appreciate everybody pivoting from last week when we were shut down. And I hope you enjoyed a nice day baking cookies, staying warm. And today, I hope everybody spends some time outside, grounding themselves on the grass and enjoying some much needed sun. Want to again thank you all for participating. And I see that Derek Flerlog, our bureau director, has joined. Wanted to see if he wanted to come off mute and say a few words to the group this morning.
Sure. Thanks, Melissa. Hey, guys. I am traveling. Had an opportunity to be part of a convening from the Kansas Health Foundation yesterday around food insecurity and hunger, which childcare certainly plays a role in. And had an opportunity to do a data walk that was put on by the Kansas Health Institute. Some it was sad graphics, but it was good to see the data in one place. Learned that about 1 in 4, 1 in 5 children are food insecure, meaning that they do not know, or there's uncertainty, or they do not have enough food to live a healthy and active lifestyle. So I thought that was very sobering. And then, of course, the cost of groceries compared to net income, and the disparities there across, how much a family makes, and that certainly applies in the childcare realm as well. Of course, one of the other programs I oversee at KDHE is WIC, and so I tried to wear both hats and see what we can do as a group to come together for some potential policy solutions. And so I just wanted to mention that to everybody. A little bit unrelated to the systems improvement team, but I think food and hunger are certainly part of the system, right? So I felt like it was relevant to mention to everybody. Of course, we have food programs and always looking to improve the delivery of those. So I think lots of good partnership going on across the state and continue exploring those. I did want to mention, Melissa, to everybody, and I apologize if this is going to be a part of the agenda or come up at any point, but we've been meeting with Wendy Doyle, who's CEO of United We, and we're doing some collaborative efforts with the League of Kansas Municipalities, Kansas Association of Counties, and really exploring that partnership too. That's really general and broad government speak for we are seeing how we can make things better for childcare across the state. And so excited about all of that is going on. And then just wanted to reiterate how important we see this group, the systems improvement team, and the pivotal role that you all have been playing and should play and will play in the future. And so just wanted to, again, we are all ears for how we can make, our efforts better with you, how you guys might define what you do with us differently, and just taking general recommendations. So all the ears for that. Please let me know if anybody has any feedback or ideas. With that, I'll be quiet, put myself back on mute, and hope you guys have a fruitful meeting.
Thank you, Derek. I do appreciate the work of KDHE and the Health Institute moving forward. Food insecurity. It is something that when we looked at our regulations, we were very mindful of making sure we were in line so that children in out-of-home care receive a very balanced meal. So appreciate that conversation moving outside of our purview and into other areas where children might be the most vulnerable. So appreciate the updates. Megan, we can probably go back to the first slide, and again, just a welcome, and then turn it over to looking at member updates and what good stuff. I think Derek really started us off by giving a KDHE update with conversations around the state, but really wanting to look at what other bright spots members have and they would want to share. So I'm just going to do the awkward pause until somebody comes off mute and shares what's going on in their realm of the world.
Actually, while we're doing that, if you don't mind, I might run through a couple quick state updates so people can continue caffeinating and think about any bright spots they want to share. So I did want to note that Derek talked about the United We report. We shared this last meeting, but that was in December, so might need a refresher. United We released a report on childcare in Kansas late last year, and have also released similar reports from Missouri and Oklahoma. So we just wanted to note that there are multiple reports in case anybody's interested in differences in our neighboring states. And also just wanted to and I think this is an ongoing question for the group. People don't necessarily have to share today, though you certainly could, of the CIT is actually specifically noted in the group as as a group that can be influential in continuing to make improvements with childcare, which makes sense. But wanted to just kind of create an open-ended space for people to respond to the report if they reviewed it, or if, a month from now you think of something about how the CIT might play a role. Just wanted to make sure that that's still on people's radar. So I'll take a minute if anybody has comments on that now. But again, just know that we're here to listen. And as Derek said, KDHE is continuing to have conversations. But also wanted to hear if what you read in that report resonates, and if there's a lot of information sharing and trying to kind of keep up with quite a bit of change that's happened in the childcare landscape over the past few years. And we just want to make sure that people are understanding what types of information is being shared publicly and if it feels right or not.
And can I add on to that, Megan? Because again, as Megan shared, there's a Missouri report and there's an Oklahoma report. Always interested in what our neighbors are doing and where they sit within that. So if you would like links to that, those specific reports, we can get you copies. So I think it's always important to look to just understand where we sit as a state compared to some of our neighboring states. And then as you look at the current United We report, if there's anything specific as a systems improvement team member that you have questions about, or that you have comments, or you're wondering the status, because some of the initiatives noted during that report, KDHE has been tackling. And so if there are things, again, that you're just wondering, that we haven't filled in the blank because some of it might just be our day-to-day work, please feel free to reach out to myself, Derek, or Jarvis Dolman, our other childcare licensing director that focuses in on operations, and we would be happy to fill in the blanks and give you any information or share. We might be still not fully fledged in one particular initiative, and maybe you have a great idea to help us get there. So want to keep the open conversation going.
and I'll mention for everybody too, this is Derek again. There is an informational briefing this afternoon to the House Commerce Committee at 1:30. That informational briefing is going to be focused on mostly on child care. And so there'll be several different speakers. We'll say it's not really testimony, but speakers as a part of that, including state agencies, including a couple systems partners. And so you all are welcome to YouTube that. It's on YouTube at 1:30. And then Thursday will be the hearing for the Office of Early Childhood bill itself. And you'll hear formal testimony and things of that nature that day. So I wanted to put that plug in too. And I would propose that we hear some bright spots now.
Well, I would propose that too. And I think one of the system's bright spots, Megan, is the child care zones. If you would want to chat a little bit about our zone initiative.
Sure. So KDHE launched what is called a Child Care Zone initiative in late last month. It's a funding opportunity and it is currently open. So anybody who's interested needs to submit a letter of interest by this Friday. And basically the gist of the funding opportunity is looking for at least two counties. They don't have to be adjacent, but at least two Kansas counties to come together and propose solutions to create what we're calling like childcare ecosystems. So what are like really hyper local regional needs around childcare, and how can communities come together to they basically can propose what they want to do. It can't be construction, it can't be like physical infrastructure, but are there they could do something like coming together to create a substitute pool around childcare because they know that very few providers are able to take time off. They could come together and have a centralized group do some of the administrative pieces of operating a childcare facility, like supporting the food program or business practices, that kind of stuff. So similar to what we've seen with shared services, that is a model that could be applied. They could do more around just kind of strengthening positions for people that are like, we know there are a lot of people out in communities that are wearing 10 to 15 different hats of issues they're supporting for their community, and childcare is often one of them. And is this a way to kind of really invest in making sure those people are solid and supported so that there are like longer, more sustainable approaches to childcare locally? So we've had TA available. If you and your organization are interested, or people that are interested, like please know that the TA is available to kind of help brainstorm. I think what is different about this funding opportunity is that it is not for any one specific facility or one specific entity. It is really focused on a collaborative approach across at least two counties to create more like long-term solutions for childcare. And we're also asking that people can really demonstrate like their knowledge of the local childcare need. There are going to be two application cycles. So there will be one in April and one in August, which is really just noting that communities are in different places, and some are already doing a lot of this work and would be very well positioned to start the work tomorrow, and others could probably benefit from a little bit more time and building those collaborations if they're not already in place. And there's going to be like technical assistance and just support available for anybody that's like, this feels like a good thing, but we need a little bit more help along the way. So if you're interested in learning more about it, there is a page on the allinforkansaskids.org website. We can actually drop that page in the chat. We did two informational webinars. There's recordings. There's like an FAQ and an application guidance document. So I know that's a lot quickly if you're not familiar with the zones, but we've heard from quite a few groups from throughout the state and are hearing some really exciting ideas. So looking forward to sharing more at our upcoming meetings about what Kansas communities are wanting to do to address childcare.
It's truly a project that makes me smile every day, because the innovation and the collaboration are just really just something to see moving forward in Kansas. Megan has done a great job of helping us with on the CPPR front, and just again the summary of some of the interests and the thought process, again, innovation top notch, just really a great way to rethink and relook at the childcare crisis in Kansas and really let communities do their own thing without us deciding what they need to do from more of a bottom up instead of a top down. And it's just been exciting to see them just take the mantle and run with it. So can't wait to share more.
Two more quick updates, and then we promise we'll turn it over for member bright spots. Last Friday, we had the Early Childhood Government Summit. This is an annual event where all of the early childhood governance groups come and do a presentation. Melissa gave one on the CCSIT. And then also John Wilson gave a nice legislative update from Kansas Action for Children. So I know Emily noted in the chat she's going to share a little bit more about that side of things, but also wanted to note that that summary is available on the Children's Cabinet site if you want updates on either of those. And then an upcoming event, Melissa and Amanda Peterson from KSDE and several groups from school districts across the state and the fire marshal are going to come together on March 12th during the All In for Kansas Kids webinar and talk about what collaboration between USDs and childcare facilities can look like. We know a lot of groups around the state have done this successfully and others are interested. And so this is an opportunity to really highlight like what the experiences of some of the people on kind of both sides of this have been, and also just things to be thinking about if you're having conversations with your school district. And then they are also working on a one-pager and kind of creating like a list of resources for anybody that is interested in that type of collaboration. So that webinar will be from 12 to 1 on March 12th. Okay, member bright spots. What's happening around the state?
Well, this is Emily Barnes with KAC, and I may just go ahead and jump right on, kind of on the tail end of everything you guys have been talking about in the spirit of collaboration. To give kind of a quick legislative update of what's happening over in the State House across the way from my office. It's actually been a really slow year for childcare activity. We all know what's about to happen, but it's just kind of, taken a minute. But we had a wonderful turnout to our Early Childhood Advocacy Day event on February 5th. That morning, the weather decided that it was going to give us a run for our money and see how challenging it could become. But even with the inclement weather, we still managed to have more than 100 people who were able to make it to the State House. And they met with more than 56 lawmakers. And they had an opportunity to hear about, some dynamics of the child care workforce and listen to a panel of state agencies. So everything you're saying about all the collaboration that's been going on, like we were able to also see some of that happen in the State House as well. And so, we're hoping that we will be able to continue this energy and progress as we progress into this next half of the session, now that turnaround week has happened, so that we can keep making early childhood a great experience for our youngest Kansans. Knowing that like the children who are born today are going to see the 22nd century. KAC knows, and all of our partners understand that investing in our children now helps us determine Kansas's trajectory for the rest of this century, and it gives us the opportunity to focus on things like the bipartisan early childhood proposal. So we've been tracking SB 132 and HB 2294. These bills revive the effort to work toward a concept like Office of Early Childhood, and effectively the effort really is about streamlining the early childhood governance system, which can reduce government red tape and barriers for the families. After kind of some waiting and anticipating what's going to go on, we have word now that there will be a hearing on Thursday at 1:30 in the House Committee on Commerce, Labor, and Economic Development. I've already dropped the YouTube link in there just that way, anybody who wants to watch that hearing. There is also today, Representative Tarwater requested some information about early childhood and childcare in general. And so there will be some state agencies speaking and some organizations. You can also, when you go onto the kslegislature.gov website, if you go onto the Kansas Legislature website and go into the area where you can get to the videos, look for House Commerce, Labor, Economic Development, and use today's date. Look for today's date, and it's a 1:30 meeting. And you should also be able to find the YouTube link to watch the briefing that happens today. So, as we have the hearing on Thursday, we will continue to watch to see what happens in the way of activity for it being worked, and whether or not it passes out of committee and makes its way to the floor. And we will continue to monitor that and try to update it. One great way to get updates on how it continues to progress is to sign up for our State House Snapshot, where then you can get weekly information on what happens. In addition to the steps taken towards the bipartisan early childhood proposal, Senator Titus put forth a bill. It was actually introduced by Senator Fagg, but he worked towards some legislation that can reduce some specific barriers to childcare operation. So SB 207 would establish a pilot program to offer health services, including telehealth and teletherapy, as well as stipends for prescription medication, which could be offered to childcare workers, whether childcare providers, staff in a center, things of that nature. Other elements of the bill would prohibit stricter local ordinances that could limit a child care provider's ability to fully operate under their KDHE license. And another component seeks to find a state match to bridge the gap between reimbursement amounts between the two tiers in the Child and Adult Care Food Program, CACFP. Right now, there are no scheduled hearings for either SB 207 or its companion bill on the House side, HB 2383, but that's one of the things that we're continuing to monitor. And if that is something that's important to you, reaching out to your lawmakers can also be helpful to elevate that concept. Another thing to consider is some of these other bills actually get outside of the scope of early childhood, kind of in the vein of what Derek was talking about earlier when we consider things like food insecurity and all that. There are some other bills that the team also tracks that, although they don't directly affect child care, they do benefit families. And so therefore, I want to make sure you all know about them. Looking at concepts like a child tax credit. And so although a child tax credit doesn't directly affect childcare policy or regulation, it can help parents afford tuition more easily. And so support for things like a child tax credit can benefit families. And so we are seeing that specifically with HB 2210 and SB 179. HB 2210 would be established as child tax credit for ages 0 to 3, while SB 179 would establish a child tax credit for ages 0 through 5. So they have different amounts that, like different price tags that they come along with, because they, support a different level, number of children. At this time, there are no hearings for those set, but we're continuing to monitor those. Another one that can be helpful to consider is HB 2119-2119. That would eliminate the Kansas Affordable Housing Tax Credit. That passed through the House at 85, 85 to 36. What this does, this does not have a positive benefit for families. This actually is harmful to them. But considering what would happen if, parents are no longer able to access a tax credit that helps them support their families. It passed out of the House last week during turnaround. Right now, there is no activity scheduled for it on the Senate side. We're going to be continuing to monitor that. So again, if this is something that makes it on your radar, being in contact with your lawmakers about the impact that losing that credit could have for families might be something that is helpful for you. And then also, 20 HB 2074 would include renters in the homestead property tax. They held a hearing on that in the House. They have not worked that, because it's from a tax committee. It is an exempt bill, and so therefore it can still be worked. So again, we're still kind of monitoring and making sure that we track what happens with that. On the health end, we have a couple of bills, HB 2386 and SB 271. They're identical bills, they're companion bills to each other, but they would update eligibility to the Children's Health Insurance Program, CHIP. No hearings are scheduled on that. And again, not being specifically in the vein of childcare, this also does impact the health and well-being of the kiddos in care. So might be something that you want to look for and kind of watch how it's going along. SB 79 is another bill that would have the impact of disallowing SNAP recipients to purchase soda or candy with their benefit card. And on the surface, the language looks like something that is beneficial for health and well-being and nutrition for families. However, in this way, it's something that you might want to learn more about. It did pass out of the Senate at 29 to 11. There are some nuances in the bill that you may want to learn more about. And it might come up on the House side. We're not sure. We're watching for it. If it comes up on the House side, it may come up next week in the Welfare Reform Committee. And one of my colleagues will be paying attention to that activity. And then finally, I wanted to bring attention to the budget, House Bill 2007. It passed out of the House last week, 83 to 36. It is progressing over to the Senate side. Work on the budget this year is happening very differently than in past years, and it has a much tighter timeline. As a result, we're hearing that there may not necessarily be time for public testimony in the actual hearing. So submitting written testimony and reaching out to your senators or the senators on the Ways and Means Committee directly can actually be helpful. We have heard that the KSDE budget, traditionally in the past, they have a lot of subcommittees for the budget. This year, they're not doing a lot in the way of subcommittees. However, the KSDE budget is set to be heard in Senate Education, and I will be continuing to monitor when that makes its way onto the agenda. But then the DCF and KDHE hearing will be on March 5th in Senate Ways and Means. And so it's one of those things where you'll want to kind of keep an eye on that activity. This can impact the funding that our early childhood system receives and therefore is able to work with. So although I want it to be bright spots, it's a bit of a mixed bag, but it's activity and we're doing everything we can to monitor and keep everyone updated on what's happening over there. Again, if you're not receiving KAC's State House Snapshot, I would recommend that you go and join the newsletter so that you receive weekly updates. And then also utilize the kslegislature.gov website to track the bills that are important to you. And I'm happy to answer any questions and go from there.
Thank you for the update, Emily. I appreciate all of those, including those on today who braved the cold for the advocacy days. I saw some great photos, and I'm going to give a shout out to Adrian and Anel because I saw a great group shot of you guys at the Capitol. So appreciate that you went as a group representing your community. So again, thank you for that update. Anybody have questions? If not, you can go ahead and definitely put them in chat. Emily would be more than happy to answer. But wanted to give another shout out to a bright spot in another community, in our community of Pittsburgh, and who had a group of providers and licensing specialists and partners joined together to discuss a local ordinance and really did a great job. So I'm going to put Kristen on the spot and share her bright spot from Pittsburgh because I think it's a great community effort.
That really was a great community effort. And I don't cover Crawford County, even though I'm based in Crawford County. So Kelly definitely led the way on that, and she did a phenomenal job of advocating and pulling in resources and just doing all the things. And so I think that was our first step. The provider did win the process of it, the community ordinance, but just neighbors sometimes aren't very nice. So I think she's going to be relocating to somewhere else. But that's definitely a barrier that we need to work on in our area just to kind of help get things going. But it was really, really cool to see so many people come all the way down here to our neck of the woods to stand up for early childhood. So it was great. We also attended Early Childhood Advocacy Day, and it was fabulous. And we plan on going every year. So it was a really good time.
Good deal. Thank you, Kristen. Any other bright spots we'd like to share before we move on to the rest of our content? Okay, Megan. Oh, Dana, I see you came off mute.
Yeah, I was just going to say, I got to be part of we called it like a mini conference. It was a professional development event that we held in Goodland, Kansas, in conjunction with their Early Childhood Coalition. And we had a really good turnout on a really horrible weather day. So it was just a nice day. And I think people learned something. So it was a nice event.
Thanks, Dana.
And who doesn't want to visit Goodland and the beautiful sunflower Van Gogh off I-70? So extra bonus for you being out there, Dana.
Okay, we have quite a bit of content to share with you, so I'm gonna switch gears. So we wanted to talk briefly about the regional roundtables. So as a reminder, we held one in Abilene in November and then Topeka in January. And then we've scheduled in Wichita. Child Start will be hosting us in Wichita on March 12th, and we will be at a childcare facility in Garden City on May 20th. And so far, the attendance has been good. Thank you to all the SIT members who have attended so far. We're going to talk through some of the themes that we've heard and what we're proposing for the kind of next steps with this work in a minute. But really wanted to focus right now on brainstorming with you all. We want to make sure that we're getting as active of participation in these conversations as possible, and also that people feel like, we've heard a lot of positive feedback, which is really great. We don't want to discourage that by any means, but we also want to make sure we're getting both sides of the spectrum. And if people have feedback about experiences related to childcare and licensing that could be improved, that's also really very valuable. And we want to make sure that people feel like they are able to share those in those conversations. And so I would open this to everybody, but particularly anybody who's been in either of the sessions. If you have any thoughts of how could we get more open discussion with the group? And then also we're wondering for Wichita and Garden City, which SIT members are able to attend and potentially help facilitate. So people really feel like they're hearing from this group as well.
So I'm going to put Heather Ritchie on the spot because Abilene was such a really well-attended event. And if you want to present from a systems improvement perspective of what your thoughts, feelings, interaction, occurred during that event, I'd like to hear from your perspective.
Sure. I thought it went really well. we had people from, I mean, we had home providers, we had staff from centers, we had education. I'm trying to think of who else was there. We had specialists. I think we had like a lady from economic development. But I thought everybody shared. I thought it was really good. I liked the way you guys kind of made everybody share. And I know that your other meeting probably in Topeka was bigger. I wasn't able to attend that one, but this was a smaller group. So I thought we could have the discussion as a whole group versus splitting out into groups, which I thought was good. But I like that, you know, you guys ask questions and that it was kind of a, not a make you participate, but kind of a make you participate type deal so we could hear from everybody. And I feel like that way everybody does feel like they can be heard.
Well, I appreciate your feedback. Anybody participated in the Topeka site? I'm just perusing through just to make
Yeah.
sure.
This is Emily Bonilla with KSDE Child Nutrition and Wellness, and I attended the Topeka session, and I have the same comments that Heather had. I mean, I think in Topeka it was a good group discussion, and I feel like it was pretty open, and everyone was willing to share and provide feedback, and I feel like that space was very welcoming and inviting for people to share any feedback that they had and ways to improve things that were going well. And I like the questions that were asked, and I think there was time to dive into that discussion and hear everybody's thoughts. So I had a really good experience. So I appreciate you guys putting these together.
I think the word that you used, Emily, that warmed my heart the most is welcoming, because that's really what we want. Even if it's a comment that we're not doing the work to the level that others expect, we really want to be transparent. So I appreciate that. And we heard feedback on both ends. So I really appreciate the word welcoming. But what we would like to do is in these two sessions in Abilene and Topeka, there's you've seen a lot of myself, Jarvis, or Derek standing up top, leading the conversation. And really when we put this as an initiative moving forward, when we were discussing it this summer and, you know, brought it to the systems improvement team for validation that this is where we needed to go, we really envisioned, or I envisioned myself, the systems improvement team staff leading some of these conversations. So as Megan shared, our next stop is in Wichita. And I see Adrian, I see Anel, and I see others that may have an opportunity to participate, Mandy, in Wichita, because we will be in Mandy's neck of the woods, because Child Start will be hosting us in Wichita. And we would like our systems improvement team members to be up front, to lead the discussion with those who show up to participate, and really see the face of the systems improvement team versus the face of KDHE staff, and would really like you guys to mull that over, and then reach out to Megan or I to really flesh that out. As Emily and Heather both shared, we ask three very simple questions to lead the conversation, and nothing in depth. As a systems improvement team member, we're not asking anybody, because definitely we're not upfront saying, hey, we can solve these problems today. But what we are doing is validating everybody's comments and making sure they're heard, and listening. And would love to have our systems improvement team be the face of the next two sessions moving forward. Again, First one is in a few weeks in Wichita, and then we will be meeting in May in Garden City. And the location in Garden City, really excited because we're going to be going back to a childcare center. So really going to be in not only talking about the work for early childhood, but we will be in that space, which was just really a fun place to be in Abilene. So wanting you guys to mull that over, but we will be reaching out to anybody who will be participating in Wichita, not just those who actually live geographically in Sedgwick County. Will we be reaching out to, but if anybody has any questions about what that responsibility will look like, we would be more than happy to discuss that with you.
Melissa, I would be glad to be part of that and get the
I figured you
information.
would, Anel, and I appreciate that.
Okay.
Thank you, Anel. I got a chat as well. So if anybody is interested, feel free to reach out to Melissa or me, and we'll follow up with an email just so you kind of know what that looks like. We really, really appreciate it. And thank you again to Child Start for hosting us in a couple weeks.
Yeah, and we come with all of the equipment. We are very low tech in these roundtables. We have sticky notes and just like poster boards, and we collect them. And you all will laugh when I shared the sticky notes with the systems improvement team, our KU partners. I just take a picture and forward it to them. So they very low tech, but we just like you to facilitate and keep the conversation going.
Okay, I'm going to run through these next slides fairly quickly so we have time to do our breakout discussion. So we are, as we do the events, we're compiling feedback and trying to like group them by themes because we're hearing some things that are very different, and I mean, we've done 2 regions, but some things that are very unique to the region, and then some things that are, we assume, probably pretty common across at least a lot of the state. So we'll share a little bit of that here shortly, but what we're thinking is let's do, maybe after the Wichita session next month, like at some point creating work groups to really dive into these themes and making recommendations on how to act on them. And I think this is really about both making improvements to make experiences better for people and scaling what's working really well. But also I think have made a commitment to people who have attended that like we want them to know that their feedback led to something and to be able to share that back with them. So we're kind of holding that information for now. I'm certainly happy to share the themes that we've seen to date, and I'll go through that here in a minute. But also just welcome thoughts on like what else should we do with this feedback? We do not want to just be the keepers of information, and we want people to feel like it was really valuable for them to come and spend their time with us, and that their feedback has been taken seriously. So that's what we're thinking for now. That's still kind of we're still in a little bit of a holding pattern as we get through a couple more events. But just a few highlights. Things we've heard that are working well in the 2 regions that we've been, which are Northeast and North Central. We heard a lot about positive relationships between providers and CCL staff, which we're going to dig into how do we scale that in the last part of our agenda today. I think we had great participation from USDs and like local government, and hearing from people who are saying like there is like collaborative conversation going on. And then I think this probably isn't surprising to people who work with childcare providers, just the peer support that people have developed on their own. And again, I know I'm running through this quickly. This will all be shared in the slides. Some of the things that we've heard that the state could potentially do to better support those regions, increasing consistency of available trainings across states so that people can get their training needs met. Thinking about how could people have trainings recognized from other states if they've moved in. I think we heard both the good or both like positive collaboration with USDs, but also like that's a big step toward collaboration. And so how can there be more support to really encourage those types of collaboration if it's appropriate? And I think the upcoming webinar will hopefully be a good step toward that. Individual coaching for facilities, and then just more increased awareness. Again, I don't think any of these challenges are going to be particularly surprising. I think it's the common childcare pieces that we hear and anticipate hearing probably throughout the state. But we are both grouping these together and then also keeping them separate so that we don't lose, like the point of these sessions was to understand what are the nuances in each region. And so we will continue to collect this information, and we have it. If any of you are in these regions and you want the information, like we are happy to share it. But just know we're anticipating probably kind of the next phase of the SIT to be able to dig in and figure out how do we take some action from the feedback that we've gathered. I know that was a lot quickly. Are there any questions about kind of where we are with the roundtables? Okay. Well, stay tuned. And thank you to the people who are plan to attend in March. We will be in touch soon. And we will just kind of continue to think about how we use this feedback and make sure we're sharing it back with everybody who attended. Okay, on that note, just in general, I think that is a commitment that KDHE has made, is like, how do we make sure that when people do share feedback, that they kind of know what happens to that feedback. Of course, not all feedback is necessarily going to lead to a change, but when it is, how do those people who submitted the feedback know that, and how does the early childhood system know that? I think we, Melissa and Derek talked about the conversations they're having with United We of like, as that report came out, some changes were actually being made in real time, and so like sometimes it's just hard to track that. And so we're exploring like creating some sort of like online tool so that people can kind of see like what are some of the initiatives that childcare licensing is working on, and where is the status of it, so that or if maybe it hasn't started yet, but a change might be available in 6 months or whatever, and then just why some of those changes, just so people can feel a little bit more plugged in and aware of changes that are happening when it relates to childcare licensing, and also continuing to just make sure people feel like there's an open door for providing feedback. So that is in the works. We will continue to share updates on that with you, but wanted to just know that those are conversations that are going on, and would certainly welcome any ideas you have to continue to make sure that people know that they can share positive and negative feedback and follow along with the work that childcare licensing is doing. Okay. All right. I know we're throwing a lot of content at you. I promise we are not going to talk for that much longer. We are going to do breakouts very shortly. Melissa, do you want to talk about this, or do you want me to talk about this?
I can go ahead and introduce it, because really need your assistance. In our previous regulation review, we added competencies for our program directors, our lead teachers. They're already embedded in regulation for our school age program, which were really welcomed in the early childhood system when we were discussing them with providers, because they provide a guidepost. And we wanted to do the same with our licensing specialists. The licensing specialist role is so much more than a check sheet, and they're in a facility, just checking compliance. They provide more within a community, as evidenced by them participating in today's systems improvement team. And each and every one of you have interacted at some level in some points with the licensing specialists. And so we used our, as a draft, some of our national standards for licensing specialists and tweak them from a Kansas perspective. And now we want you all to react to them and provide us feedback. And when you look at a competency, you're looking at a competency that measures knowledge, skills, and abilities and behaviors. And again, this is from the lens of your own specific role and interaction and expectations that you have. And this is a way for childcare licensing to have basically a standard position description for all of our licensing specialists. And we do have that, but we want to be very transparent and elicit feedback from you all. So that being said, KU sent out with our agenda a draft of our licensing specialist competencies. And we are going to break you out into groups. And we really want you to spend some time looking at this. And what I've provided, and I'm not going to spend a lot of time looking at it, or you guys will have this as part of your notes, is just some of what the licensing specialist role is, so that you have an idea beyond just the traditional, again, that checklist that that I always think of as an inspector going into a facility. But they're their partners, they're their local experts. So here is a quick primer of what the licensing specialist role is, and a very 3,000-foot view from the system. And then the next slide, I really wanted to provide some context of what they do yearly. And this, from some of our licensing specialists, this might be just like, wow, did not know as a state we did all of this. But last year they conducted, in the state fiscal year 2024, 413 orientations. They did over 5,000 inspections. And they did what many folks don't realize is they do a lot of trainings at the county level themselves. So they did 128 trainings, impacting almost 3,000 participants, and those are all providers at the local level. So it is quite a bit. It is not just the inspection process. And then themselves, they have a requirement to participate in professional development, but they always go above and beyond. And so they had 290 professional development courses totaling 735 hours. And we only have approximately 59 licensing specialists. So that is an amazing amount of professional development that they take yearly. Wanted to provide some context and before you guys break out into your sessions. So let's quit talking and hear you guys share feedback on what you thought of the competencies.
So we are going to go into breakout groups. You're going to be randomly assigned 2 of the 6 competencies. And these are the questions that your facilitator will work with you on, but really wanting to know what basically does this feel right? Or does it feel like something's missing? Is there a skill or something you'd really like to see added? I think also, does the language feel accessible, and does the language resonate with you? And if not, that's great feedback. And then also, if you feel like there's something that's missing or something else you feel like could happen to increase consistency across the role, we want to hear that too. So we will take 20 minutes. You will get 2 competencies. If you are don't feel like you only have to provide feedback on those 2 for the sake of these breakout groups, we'll focus on 2 randomly. But whether it's during the meeting today when we do a share out or just after, these are all available for you. And really, I think we would love to have your feedback even beyond this meeting. So if you can, when you get in your group, assign a note taker and a representative to come back and share with the group, that would be great. We will take 20 minutes and then we'll come back together and do a quick debrief and wrap up from there. If anybody doesn't have a copy, your facilitator should have a copy to be able to screen share. But if anybody needs the core competencies emailed again to them, let us know. Okay, we'll see you in a little bit.
I always love this when we get whisked away.
All right, Bree, are we all back?
Yeah, I think we are. And I was mid-sentence. Rachel, can you send me your chat um, notes on humility? I would appreciate that. We were still talking away, Megan, when we got whisked back.
I understand. Understand. All right, well, we can do some quick report outs. So I was on the first group, which was accountability and caseload management. So we can share, and Anel, I'm going to do my best from memory, and if you don't mind jumping in and helping me, I would appreciate that. So we on accountability overall felt like this was good. It felt like the language, share my screen so people know what we're looking at. Overall felt like this was comprehensive. I think one pretty easy change is here on behaviors and other characteristics on number 3. It says follows the important laws. We feel like all of the laws are important, so should just say follows the laws. There was one question about, and Melissa, I think you're going to talk about this with the group, but like how these competencies will be shared and then how kind of people will be like determined, like, are they meeting the competencies? And if not, like what would happen? So I will let you respond to that when you share, but that ended up being a little bit of our discussion on accountability. And now, was there anything else on this one?
No,
Perfect. Okay. Yeah, I think overall felt like this was the language was clear and comprehensive. Caseload management, the things that we talked about were maybe adding the skill around like adaptability. And we had fortunately had a couple of people with experience on the call who were able to speak to how caseloads fluctuate month to month, just based on when surveys are happening, if there are other complaints or issues that people are dealing with. So feels like that, like being able to adapt to that fluctuation is an important skill for people to be able to demonstrate. And then we also talked about, and didn't quite land on language, but maybe something around like demonstrating respect both for people's spaces that you're going into. Oftentimes they are people's, personal spaces and maybe their home, as well as just the time, respecting providers' time when you're in their space, and also just like understanding kind of the amount of time it takes to do this work thoroughly. And particularly if you have a month where you have a higher caseload, like not making sure you're like committing to the time it takes to be thorough. So no, what did I miss there?
no, I think you covered it pretty well. We did mention that several of the competencies overlap. Like some were in communication, so they do overlap in different areas, which is probably good.
Anything else from our group? Melissa, do you want to hear everything and then respond, or do you want to take anything?
Oh, let's go ahead and I'm just taking it all in and taking
Okay,
notes as you guys are chatting.
perfect.
If you don't mind, let's go ahead and hear from all 3 groups and then we
Yeah,
can summarize at the
absolutely.
end. And we can go ahead and segue right into my group, and I will apologize. We didn't follow the rules very well. We were top heavy with some licensing specialists, so we really wanted to hear from the group outside. So before Angela comes off mute and shares, I just wanted to share, we didn't always follow the rules. We really wanted to, words matter, and we wanted to sort out the competencies in ways that making sure that what was the most important, and really appreciate feedback from the rest of the group in a different lens, and focused in a lot on accountability and communication and leadership. So, and then what was most important. So I will let Angela, but I just had to preface so she didn't feel bad that we didn't, kind of were all over the place. We got really excited about the conversation. So I will let Angela give our team's summary.
Yeah, so we talked about the order of the competencies and if it mattered or not. Maybe our highest priority at the top three priorities at the top, and then going down from there. So we talked about communication, and how before it was maybe they were sent to resource and referral agencies because they had a violation and they needed to do that or had to do that if that's what they felt like. But it's really changing, about like now licensing specialists are just sending them to resource and referral agencies or any other agencies that can really support them in whatever they're struggling with, because can't we can give overall support and encouragement and best practice and things like that, but we're not in the experts in everything and we can't dial in on everything. So just really referring them because that's the right thing to do and they can get the content that they need from the experts in their field. Um, let's see. I'm sorry, I'm just reading my notes. We changed quality improvement and supporting compliance. We changed the order. We felt like compliance is a component of quality, and we suggested this be at the very top. We talked about accountability, and that should also be at the top. And we talked a lot about, we all are human and people make mistakes, and having that, really working relationship. Like if we do make a mistake, calling that out and trying to fix it as soon as possible, but then also building that trust back up if we do make a mistake. But just having that, ownership of like, if I did make a mistake, let's work through this. And then we talked about advocacy, just making sure those are addressed in the competencies, because I feel like daily we're advocating for providers, and we all do that in different ways, but just making sure it's in there, because I feel like also that helps build trust with providers, that they know, like if we do go out and cite them for a violation, we're all on the same team at the end of the day. We all have the same goals. We're striving for the same thing, and advocacy is done in so many different ways. So making sure that's in there as well. But that's all I got. If the team wants to add anything I forgot.
And in real time, we used Rachel's, Jury was able to put in humility into ChatGPT, and we came up with a statement to add to our accountability competency, because I think understanding humility is important.
Cool. I can share about the final group's discussion about compliance and monitoring if everybody's ready. So I'll just go ahead and give a little synopsis, but anyone from the group feel free to chime in and add anything that I might have missed. So one of the things that we talked about was the question of like if these core competencies would be disseminated to providers as well. We talked about how that could be helpful just in the relationship to establish some like common expectations of what providers should expect from the specialist and so on and so forth. And also just to better understand what is under the purview of the specialist and how that relationship should look. One of the things that we talked about is just like some minor wordsmithing things. There was one line on the monitoring page that says effectively manages emotions when faced with difficult or disturbing situations. We talked about how that could potentially be bettered by saying like effectively manages composure instead of emotion, because sometimes emotions can be a little bit unexpected or uncontrollable. So the professional aspect of keeping composure and remaining effective and professional seemed to be a little bit better word precision for that. And then we also talked just a bit about communication and how important that is for both monitoring and compliance, and just how that should be prominent in these breakdowns. So not necessarily that there was a specific line to change, but just making sure that effective communication is like a common expectation and something that people understand is very important in these. But that's what I got from our discussion and took notes from. But if I missed anything, please feel free.
I thank you guys all for the feedback. And so what is KDHE going to do with these next? What are our next steps? We will continue to take open comments. We do have a quarterly meeting today with our licensing specialists following this, and we are going to go through the same feedback that we did with you guys. So the conversation's not closed. You all have hard copies, and if this was your first peek at them this morning, totally understand. We have lives and we are very busy this time of year. So would love for you to take a minute to review them and send additional feedback because I really echo Clayton's comments. Words matter, and we want to make sure that what we're putting out really resonates with not just our program, but also the early childhood system, and more specifically, facilities providers and staff. We would want to make this just a very open piece. In our regulations, we have competencies that we expect of our program directors, our lead teachers in child care centers, and that's very much a public-facing document. This would be the same. Other steps included, KDHE really wants to maintain that we are being consistent across the state. And so this is, again, a guidepost to ensure licensing specialist consistency. We are also working on a standard test that our licensing specialists will take, that will go through all of these, that will echo all of these competencies as they relate to our program. This will be new to all of our new licensing specialists that we are working with, and then we'll spread out to our other licensing specialists that have been in the system for a while. KDHE is also over this next spring and summertime, we are shadowing all of our licensing specialists so that we can note that they demonstrate all of these competencies that we have forth and all of our expectations in our policy and procedure manuals. Because we really strive for consistency. So if you are opening a facility in Rollins County and you suddenly move all the way down to Crawford County, that you get the same type of support, communication, leadership, accountability that we expect in both areas. And so those are big, lofty next steps, but they all stem from making sure that we get the core licensing specialist competencies correct at the beginning. And so your feedback is invaluable, and looking forward to getting more as we move forward in this project. Then I'll
Thank you
pass it to
all.
Megan.
I know it was a very full agenda, so thanks for being willing to hang in there with us and jump around a little bit. As Melissa said, feel free to email any feedback. We can send the competencies out again with the notes, and just have the open invitation for feedback. Just a reminder, in a couple weeks we'll be in Wichita for the regional roundtable, so we'll follow up with those of you who have reached out and noted that you will be attending. Thank you. We will not have a group meeting in March. We will meet again in April, and then we will have a flyer coming out soon for the Garden City Roundtable. So thank you all. We appreciate you. Hope you can enjoy the sunshine if it's nice where you are, and have a good rest of your day and week.
Can I just share one more thing, Megan? as we compile all of the feedback from the competencies, there may be an opportunity to share out the final document, because I would not like to publish anything and without you all looking at the final document. So please note that in March, even though we're not meeting, there might be an email and asking for your feedback, a short survey associated with it, and just wanting to keep that open. Again, cannot stress how much your input is valuable to our program, and we do not want to publicize a final document without having the systems improvement team have a reaction to that. So maybe something in March, or we may continue this conversation in April, because we really want to get this right the first time. And thank you.